Today I'm going to be discussing things about our neck and shoulders, and in particular the SC joint. So we have our AC joint that we normally talk about as therapists. And we also look at our SC joints that's not quite often treated. Now your 𝒔𝒐𝒏𝒏𝒈 joint is part of the clavicle, and remember that it's also going to be affecting the scapula and how the shoulder sits in that socket space. You'll also notice that the sternum sitting here, that first rib butts right underneath the clavicle. And when we have fixations or stickiness in that SC joint, it can actually make differences to the first rib. And then we have a whole band of problems with the neck as well. So in this technique, we're going to be doing some myofascial work with our 𝒔𝒐𝒏𝒏𝒈 joint. Kevin's a perfect example of this because he is a plumber, so as you know, they get into all sorts of tricky positions. Occasionally he will complain of neck and shoulder problems, and when I was palpating the AC and SC joints, he is actually quite stiff and sticking in that joint. So my thumb is just dropping down into the manubrial space and over onto the SC joint. Thumb over thumb, and I'm going to compress down onto the SC joint and pushing it caudally. So your client is going to get that elbow bent, and he's just going to do an active movement. So he's taking the arm in and out. As he comes out, I'm depressing the SC joint. Now it's a little saddle joint and it can get a bit sticky. So what we're doing is, if you imagine that saddle, I'm pushing like a little lever, so we're drawing it down and back. It's a really nice joint mobilization technique. It can be quite tender to start with, but after a while it loosens off, and it's actually a lot nicer than the first rib stuff that I've done to Kevin before as well, so I think we're lucking up. Now I can actually start to feel that joint is starting to get some movement or joint play. Can you feel that that's changed the last about 2 or 3? Yeah. So the arm movement is working as well. So just relax the arm. And when you think about the mechanism, as his shoulder is coming up and down, so the humerus is lifting up, we're actually adding a greater lever here as well. So we're encouraging the SC joint to do its saddle action. This is a great technique. Use it on anyone who's exhibiting first rib stiffness, shoulder pathologies, or even just when the SC and AC joints feel a little bit stiff and sticky. When you have clients and patients that come to see you with aggressive chronic shoulder pathologies, we've got a number of issues that can come from. It can come from repetitive tendinopathies, it can come from bursitis, it can come from tears and strains. We can look at adhesive capsulitis. There's a whole plethora of issues that we have with the shoulder. What we can normally do in the clinic is look at active and passive range of movement. So when I'm doing active range, I'm getting my patient to come up through shoulder range, up and down, look at her external rotation and internal rotation, and abduction and adduction. And we listen for what they're feeling. So remember, we've got the scapulohumeral rhythm issue where they get caught from about here up through, so that about 60-degree arc where they really catch and feel uncomfortable. That can give us an indication that our glenohumeral joint is sitting a little bit more restrictive. We can get information where the bursa is inflamed and there's compression pain in there, or just in passive range movement. So passively, when they're lying down on the table, I might actually feel that when I'm palpating, I can feel the head of the humerus sitting slightly forward, which means there's less space at the anterior portion of the GH joint. We do a bunch of maneuvers that will include myofascial release techniques, some glides, some mobilization techniques. But what can we give them for home care that will really make a difference? So you've got a couple of different apparatus that you can use. You can use these tubings, you can use TheraBands, but whatever you use, you've just got to make sure it's got a nice stable base and that it hasn't worn and tethered, because if you've got something that's been in the garage for 4 years, it's losing its capacity for strength and tears, then we don't want that, because we're putting quite a deal of force at the proximal head of the humerus, and we don't want to have something that smacks you in the head. So Lulu's going to take this and she's going to put it underneath the foot on the same side that we're having questionable shoulder range. She's then going to take it up and over her shoulder, but it's going to sit at the humerus, not on the shoulder joint. So we're down, if we've got the humerus here, we're down about 5 centimetres, 4 to 5 centimetres, and she's going to elevate this arm, and we're going to keep it up here so she's got a nice firm base. Yep. This hand's going to come down, and she's gently pulling down with this hand. That's it. So you should feel that distraction.
Yeah.
So coming down and then relaxing. You can actually encourage by drawing through your latissimus dorsi. So she's activating some of those deeper back muscles, part of the functional back line.
There we go.
Yep. And we're going to be doing this distraction and relaxation for a good minute. So it's just down and then up. And as that weight comes up, she's going to allow her shoulder, allow the humerus to rest up and then come down again and elevate up. So you'll always show this in the clinic first to really make sure that they've got a good handle on what they're doing. That wrist looks a little bit awkward, so I'm going to get
I have
her...
very lax wrists.
That's it. So you should be able to feel that dropping down.
Yeah.
So this could address issues with shoulder pathologies, many shoulder pathologies. If you have got an unstable or hypermobile person, this would be contraindicated. We wouldn't do this one. We need to give it strength, support, taping, and strength and exercise work. And you'll see that in some of the other videos on rotator cuff strength that I've got in the website. How's it feeling?
Very good.
Yeah.
I can feel it working for sure.
Great.
Today we're going to look at a muscle energy technique to improve our internal rotation and or our external rotation for our shoulder. First of all, we need to look at our natural range, our passive range of movement of the shoulder. So we're going to gently abduct the shoulder up to just slight of 90 and then let the arm passively external rotate. External rotation, we should get close to all the way down here, 90 degrees, and you can see by this movement that Roz is short. That could be because of the pec major, the lat dorsi, and the teres major that will be decreasing that range. We look at our internal range. What's stopping it from going internally further forward? 70 to 90 is our normal range. And we're looking at subscap, our teres minor. So that various movement doesn't look comfortable for Roz. Muscle energy technique, we're going to take the arm into external rotation and apply muscle energy technique. So 40% of your effort, Roz, you're going to be pushing up into this part of your arm. I'm holding it still so there's no movement. 7 to 10 seconds. Take a breath in, Roz, and breathe out as you relax the arm. Can you see that the most important thing here is that the arm does not move? We don't change our joint angles, and we rest here. This is our post-relaxation contraction phase. Now we're going to allow it to find a new point of bind. Can you see I've gone back quite a bit further? And again, Roz, apply that contraction to here for me, pulling up. They don't pull really firmly. It's about 30 to 40% of their effort. Much firmer than that, you can't really take good control. It must be no less than 7 seconds. Take a big breath in. Breathing out and relax. And it's quite gentle for your client. So if anyone's got shoulder range issues or pain, we know that this is going to be a nice, easy, gentle technique. Reasons you wouldn't do it is if there's a bony block when we come into these ranges. And can you see we've gotten a little further? One more time for me, Roz, please. Pulling up I always believe that we need to do it at a minimum of 3 times, because it's actually that causative length of time that makes a change to the muscle. 7 to 10 seconds. She's going to take a breath in for me and relax the shoulder completely as she breathes out. It's a really wonderful technique to open up muscles that are tight, and we all know that our internal rotators will get quite tight because we do so much internal rotation work where our arms are always forward. How does that arm feel?
Arm feels okay. The shoulder is about ready to crack.
Okay, we're going to take it up through that range. Roz also has shoulder pathology, so we need to know that we're working both at muscle. There, so that resting length is a lot better than it was before. This is just one of the many techniques that we can use for the shoulder for muscle restrictions. Be aware that if there's a joint restriction, as we just heard Roz talking about a little bit of pain back here, that we'd apply a mobilization technique, or we would address something a bit deeper into that joint capsule as well.